kindly, it is only then you will switch on your video and audio. Thank you, sir. Namaskaram. Good afternoon and welcome to this charity dinner conference organized by Joint for Development Foundation in collaboration with Little Hands Organization. Sharira Madhyamam Khalu Dharma Sadhanam, writes Kalidasa in his Kumara Sambhavam, meaning that body is an important instrument in the pursuit of our dharma of both individuals and nation. It is here that hospitals assume significance in the society. The pandemic has not only made us realize the temporal nature of our lives, but also exposed the structural deficiencies in our healthcare system. Health is a constitutional right, a basic right, and most importantly, a human right. And this human right is being violated in not just KGH, but many hospitals in the country today. KGH, King George Hospital as it is called, is not just a hospital like any other. It is a phenomenal movement with a mission, a lifeline to lakhs of people. The hospital is now in a very poor condition and at the end of its tether. As Winston Churchill said, that one should never let go a good crisis go waste, and therefore a crisis is perhaps the best time for introspection, reflection, and correction. We at JD Foundation have tried to make some intervention as little as we could. V.V. Lakshminarayan Garu has visited the King George Hospital on 31st October 2021 and inspected the condition of the wards, interacted with the patients to find out their problems. And he has proposed an alternative solution to the problem rather than relying on the regular government funds. As a part of the alternative solution, a charity dinner is being held today in Melbourne, Australia, to raise funds for the cause of KGH, a super specialty hospital in Visakhapatnam, Andhra Pradesh. To be discussing about this and the state of public health system in the country, today we're joined by an extremely eminent panel. We're joined by leaders and legends in their own respective fields. I recognize the presence of Sri Ram Mohan Naidu, Member of Parliament, Sri Kakulam. We also have our erudite, learned Dr. Jayaprakash Narayan Garu, retired IS, former Secretary to the Government of AP, founder Lok Satta. And of course, we're joined by our dearest Sri V.V. Lakshminarayan Garu, ex-CBI Joint Director, former Additional DGP Maharashtra, and founder at JD Foundation. Welcome to all of you. Glad to have you in the session with us, sir, today. I also recognize the presence of LHO and Faniraj and his team, who are conducting this and organizing this charity event in Melbourne. Also, a hearty welcome and gratitude to the media partners and sponsors who are helping us organize this event in Australia. So I would now like to request our founder at the JD Foundation, V.V. Lakshminarayan Garu, to kindly deliver the welcome address to our guests.
Thank you very much, Priyanka.
Thank you.
Yeah, welcome to this session, and also I'm extremely grateful and thankful to Jayaprakash Narayan Garu for joining this event today, and also the MP, Mr. Ram Mohan Naidu Garu, and very soon Sri Suresh Prabhuji also is going to join us. Actually, as Priyanka said, we visited the King George Hospital, Visakhapatnam, and I mean the things were pretty bad, especially the facilities like the washrooms or maybe some basic electricity issues and drinking water issues. So we thought, why not we do our part as a society, because King George Hospital is giving a lot of services to the people. It has been there for so many years. And because of various constraints on the government also, and also the policies, I mean, they may not be getting sufficient funds. And it is the time we should rope in and we should step in. And that's what the Joint for Development Foundation, which was founded by me in the year 2018. And we are basically concentrating on agriculture, rural development, health and education. As a part of it, we thought, let us take up this role of helping KGH with the minor things. I mean, we may not give them huge money, but basic things that do basically for the patients who are coming and also the people who are accompanying the patients. So they are also having a lot of issues like they don't have chairs to sit, a place to sit, all these things. So then I discussed with my team and especially Mr. Jagan Murari, who is quite active there, and also the entire team, we said. And fortunately, we got this Little Hands organization also, and they said, let us have a charity dinner organized in Melbourne so that we can raise some funds, and these funds can be utilized for KGH. And also, as part of this helping exercise, also, we are planning to have a diagnostic center in the kidney bone area called Uddanam in Srikakulam. So basically the problem there is because they don't have a proper diagnostic center. Patients all the way from Srikakulam, they have to come to Vizag accompanied by some attendant, and overnight they have to stay. All these issues are causing a lot of problems. Already they are in poverty and it is adding to the poverty. As Jayaprakash Narayan Garu always says that most of the money people spend on education and health. So somewhere we should step in and we should have a good diagnostic center at very, very nominal and reasonable rates so that the patients from Uddanam area especially and also people from Srikakulam, they can avail these facilities. And also we are planning to have a telemedicine system of sending these reports to the reputed doctors in Visakhapatnam and taking their advice and also helping the patients there, and their travel time will be reduced, their expenses also will be reduced. So these are the two projects which we have in mind. First one is for the KGH, and also second one is about starting this medical aid center or the diagnostic center in Uddanam area. Already a donor has come and he has already donated the land for it, and a lot of people are coming forward for the construction of this structure and also for the important equipment which we need to keep there. And also we are planning to have a doctor round the clock so that he is available to help the patients and also the procedures are done properly. So in this connection, this particular dinner has been organized, charity dinner. And I'm extremely grateful to the team members and also especially for Mr. Ram Mohan Naidu Garu coming and also Jayaprakash Narayan Garu. And very soon Suresh Prabhu Garu also will be joining. And also as a team, let us attend to these pressing issues and let us help and also let us improve the facilities. I mean, if you get sufficient funds, we can extend this to other hospitals also, other PHCs also. So that, I mean, the patients who are going there will get some solace and they will get some benefit. So with these introductory words, I once again welcome MP Sri Ram Mohan Naidu Garu and also Sri Jayaprakash Narayan Garu and also all the people who have participated in this charity dinner that is going on. We could see Mr. Paniraj and his team of Little Hands organizations. They have done a great job. And also there are so many media partners who have come and who are supporting for the spread of this message and also to raise funds for KGH and the Uddanam Medical Health Center. Thank you very much. Over to Priyanka.
Thank you, sir. Thank you for your kind words. And before we could go in, I'd like to play a small AV that we have prepared for this reasons. Can we have the AV, please? Please kindly check on to the audio. The audio is not clear.
We couldn't listen to the audio of the video.
All right, there is some technical glitch. I'm getting back to my team. Just give me a second. So sorry, sir, for the inconvenience. There's some technical glitch on the other side. We're trying to fix it. Just give us a couple of minutes.
Yeah, please.
Sir, are you able to hear the audio?
No, I mean, audio is not there. Only we are seeing the visuals,
All right, sir.
only the video.
So there is some technical issue. I think let's move on, and probably later when it's fixed, we can come back to the AV. So I'd probably now request Ramohan Naidu to be speaking and addressing the audience. Before that, give me a couple of minutes to introduce you, sir. Ramohan ji is an MP from Srikakulam, not a member of parliament, but I'd like to call him the member of people, more precisely the people's man. Erudite, learned and accomplished. I must tell you that he's a man admired and respected by the ruling and the opposition alike. And he has always been vocal about the special category status, about the railway zone, and about the disinvestment of RINL. Clearly a people's man. I welcome Ramohan Naidu to kindly address our audience. Sir, we are happy and glad to have you here, sir.
Thank you, Priyanka. Likewise, thank you for the wonderful interaction, and my sincere namaskar to Lakshmi Narayana Garu and JP Garu, who have always been my role models at various stages of my life, and I still look up to them in whatever I do in my political journey. And to Suresh Prabhuji also, who is going to join us in the future. And a warm welcome to all the participants in this charity dinner who are participating in Melbourne, Australia, for this wonderful cause of giving charity to the development of KGH Hospital, which is one of the most important and one of the biggest hospitals in the country of India. Even if it is located in Visakhapatnam, it's one of the biggest one, and it's got a lot of history, which started as, if I'm not wrong, as an army dispensary back in the 1800s. It's almost got a history of 150 years right now. And if you look at the present situation, like I keep visiting it very often, and for the participants there, they've also had the opportunity to see the visuals that has been presented by the JD group right now. I think I certainly feel a little shameful. I'm also a member of parliament from that area, that the hospital, which is supposed to be a government hospital, is in that condition, because we as politicians, we as representatives of the people, we are the ones who have to be responsible at first to make sure that these are having all the infrastructure are functioning well. But the kind of pressure the hospital system has in India, the medical infrastructure has in India, because we have noted lakhs and lakhs of people are visiting these hospitals in a month. So it's not exactly like the hospital, the medical care system that we have in one of the developed countries, because of the high amount of population that we have. The stress on the infrastructure, the stress on the medical staff, the stress on the buildings, it is a huge pressure on the whole system. So that is why, not just depending entirely upon what the state government, the central government is going to do, I think there is a lot of opportunity, there is a lot of potential for NGOs, for other people, for people who are good at heart, for charitable organizations. They all should come forward, and if they have the opportunity to donate, or if they have the opportunity to contribute, I think this is a wonderful opportunity, and which is why I would like to thank JD Joint for Development, and also the Little Hands organization for putting up this wonderful charity event. It is very much need of the hour right now. I take a recent example from what the pandemic that we have experienced right now. I think the pandemic has exposed all the necessary failures that we have in terms of medical infrastructure. The sudden spike in corona cases at one point of time, and the kind of burden the hospitals, the doctors, the medical staff, they all felt. I think that exposed a lot of the failures, a lot of the loopholes, a lot of the lacunae that we have in the system, and it can't be cured, or it can't be done in just one budget, or just 1 year, or just with one particular set of policy. I think it's a work in progress, but for that work in progress, we need all the minds to work together, all the different sections of the society. Everyone should come together. Everyone should be in that right mindset of contributing. Everyone should be in the right mindset of having that responsibility to look after our medical care system. I think that is when we are going to make the right progress. During the times of Corona in Srikakulam also, when the cases just shot up, they were I have never seen such gory experience anywhere. I never thought that the Indian medical system would be facing such kind of situation where the bodies of the dead bodies of people were lying outside hospitals, outside the crematory grounds and all that. That was very, very scary. And that is, I think, a lesson, and also indication that this is the time where the health needs to be addressed. When you look at the common man, or the word that we use, the poor man of India, which is very commonly used, I think the biggest asset that we can give to them is good health. To begin with, we talk about employment, we talk about good standard of living, we talk about education and all, but the primary, at the core, that we can give to any human being is good health. Once, if he has that good health, I think he is capable of doing whatever he wants to do, whatever he wants to become. So we have to address this as a priority, the healthcare system. And when we look at the stats also, the budget spending that we have is merely 1 to 2% of the GDP. And this has been consistent for the last 12 to 13 years. That's actually not the required amount for a country like India, whereas some countries, developed countries, are spending around 8 to 10%. So we have to definitely reach there. There are different ideologies of political parties which is not letting them, even the system, the whole system that we have in India, which is not letting us prioritize on health. But we slowly have to get there, where health and education both become a priority for us. Even we have to show it in terms of spending. And when I say that there is little spending, it doesn't mean that it's very little in terms of figures, because for the country that we have, that for the numbers that we are, GDP itself is somewhere around 2.5 lakh crores, and 2% of that is also a very huge money. There is some spending that's going into the hospitals also. But what are we lagging is the responsibility in spending that rupee in the right way, and ensuring that there is quality infrastructure that is reaching to the common man. So there is a lot of things which are going naam ke vaste, number ke vaste, those kind of things are happening. But exactly what quality health infrastructure that we are able to give to the common man, I think that is the thing which needs to be addressed. And for that is why I mentioned that It's not just the government or the political or the public representatives. There are a whole lot of people who come into the system, and everyone needs to be in that right mindset. You can only ensure quality when the whole system is understanding that quality health infrastructure needs to be given to the common man. And there are a lot of structural changes happening in India also right now, with a lot of information that is dissipating to the common man through the digital. We are living in the digital age, so everything is out there right now. People are able to form their opinions on their own. People are able to access information that was earlier little unknown or a little bit hidden from the common man. So there is that kind of transparency, and we have with this transparent system that we are trying to achieve. I think we can target accountability also. When we have accountability in this medical healthcare system, I think we can ensure better quality.
I think there is some internet issue with on the other side.
I will try to put that pressure individually, at least have that discussion going on. And on the other side, when people like what we are having today, when private organizations and these charity organizations, they also help us in bonding with us to improve these quality services. I think we can achieve a lot more. And the whole, I kind of want to stress on that responsibility factor. We all should feel responsible for the government's money. It's just not public representatives or the government which is responsible. It is, in fact, the common man's money that is going on. So until it is spent completely, until it is availed by someone as a service, I think the responsibility lies on the common man also, lies on the organizations that are around, lies on the people that are around, lies on all Indian citizens, that we have to make sure that there is a responsibility in the spending of that rupee also. When that kind of culture develops, I had the opportunity to go around different countries, and more than the policy making, more than the budget that we are talking about, more than the amount of spending and all, I think there is this culture, the culture of being responsible, the culture of spending that rupee effectively, the culture of giving good service to the people. I think this is something India needs right now. It used to be there at some point of time, but slowly we are lacking that responsibility factor. We are taking it away from the system. I think it is highly the time where the youth also recognize this kind of responsibility and try to bring it back to the system through the acts and services that they do in the society also. And I would appreciate all the people who have come here to show that sign of responsibility. They want to show that even if this hospital is there in Visakhapatnam and maybe we are there in Melbourne, we are responsible for the people there. We are responsible for the citizens. We are responsible for the country. So that is a very, very good sign. I think it is an inspirational activity that we are doing today. And I really wish that whatever amount that is coming from today's charity dinner gets used effectively. And I'm sure that because Lakshminarayan Garu is involved and people like you are all involved in this, I'm sure that it's going to be spent effectively. And I'm especially more happy that some will come to Uddanam area also, which is there in my constituency only. It's been like a very long-lasting problem, and we are not able to specifically target on why the area has so many kidney diseases at one specific place. But the work is going on. The governments are doing their part, and a lot of people from outside the region are also coming in, pitching in, trying to help contribute in their own way. And I'd like to sincerely thank from my heart for doing it for the people of Uddanam also, the diagnostic center, and any support or help that I can give from my side. And I would like to vouch through this meeting also that I'll be there to support. I'll be there to ensure that it comes into light and it gets opened as soon as possible. And other than that, once again, I'd like to sincerely thank all the people that are here. Staying in another country, it's very easy to get disconnected from your own country or the places you've grown up. But it really takes a strong heart to be connected, not just to give back to your parents or not just to give back to your community, immediate community or your family, but this is like lakhs of people. A single rupee that you might contribute today might help a lot of people, lakhs and lakhs of people in the future, right from newborn kids to age-old people. So it's a very important contribution, and I would like to thank JD Group and all the organizers who put up this wonderful charity dinner today for a great activity of improving the services at KGH Hospital. And the KGH Hospital also, it's not just oriented with Visakhapatnam. It's people from Srikakulam also. They are also going there. People, I've seen people from southern part of Odisha also, and some people from Chhattisgarh also. They all come and use these services at KGH. So it's a great activity that we are doing today, and I'm very happy to share the stage with some eminent people like JP Garu and Lakshminarayan Garu. And I wish that all the things that we are trying to dream of today, we are all achieving them in the future. And I'd like to pledge my support also to this cause. And thank you once again for the opportunity that you've given to me. Thank you, Priyanka.
Thank you, Ram Mohan ji. I think it's very true that you said that the COVID has exposed the systemic problems in our healthcare. And moreover, as you said, the budgets this year have spiked because it's inclusive of vaccine and COVID expenditure as well. So, am I audible, sir?
Yes,
Priyanka.
Okay. Yeah. And thank you, sir. I must also place on record that Ram Mohan ji has also extended his support towards the establishment of blood bank in the Uddanam region. For when we asked him, he immediately responded and promised to release funds from his MP lads as well. Thank you so much, sir. And as you said, you know how important KGH is to the people of Andhra Pradesh, not just Andhra Pradesh, but also from the neighboring states of Odisha and Chhattisgarh. You've always been a voice. We worked with you previously on the Uddanam issue, and we would like to work with you further as well. And thank you for extending your support towards the cause of KGH as well. Thank you so much, sir. We're very glad to having you here today.
Thank you very much.
Thank you very much, Ram Mohan Naidu Garu, for your words and also the support which you assured all of us. Because I met you during Titli cyclone in the villages of Srikakulam. We met in the village which I adopted in Srikakulam, the Sahalaputtuga. There we met, and I mean, within a short time we could get back the life back to normal in those areas. I mean, that day I had really seen you working, and also definitely your contribution is going to be a big thing for all of us. And very soon, because 15th August, we kept it as the inauguration of the diagnostic center in Uddanam. So that also we'll be coordinating with you, and also with your support, I think definitely we can do wonders there. Thank you very much for joining this session, and we from Join for Development Foundation, we are extremely grateful to you. Thank you very much.
Thank you.
Sir, we can have the AV. Can we have the AV, please? Let us try once again.
On an average, 5,000 to 7,000 people visit this place. Some with fear, some with faith, some with hope, some with despair, and some in desperation. A place that gives both life and second chances in life. The King George Hospital is the lifeline to lakhs of people, not just in Andhra Pradesh, but also for neighboring states like Chhattisgarh and Odisha. Established in 1923, the hospital is housed on a sandy hill sprawling over 27 acres, including the Andhra Medical College. From being a civil dispensary in 1845 to a 30-bedded hospital in 1857, the hospital today has 1,237 beds. And on an average, in a single day, the hospital receives 1250 outpatients, 115 to 130 admissions, 110 emergency cases, 60 to 70 surgeries, including those of critical nature, are performed. The hospital of such eminence and importance today has a disappointing state of affairs. Many facilities are underdeveloped and some are badly maintained due to an imminent resource crunch. Given the high number of visitors and patients, it's an extremely difficult task to maintain the hospital and provide adequate facilities without good finances. Being a state-run hospital, one cannot expect to run the hospital on the hospital's revenues alone. But does that mean it should be left to its fate? The current superintendent at the KGH, Dr. Maithili, has been making minor efforts with the help of charity and donations to repair and restore, but that has proved fairly inadequate. Many buildings are awaiting repairs. A building has to be built for the treatment of the newly born orphan children. Drugs and medicines are unavailable in the hospital. Since most of the people who take treatment here come from a poor background, the unavailability of drugs is forcing them to buy outside. Despite having modern equipments, the time taken to get them fixed in case of a breakdown is high. An appeal has to be made to the governments to fix the equipment, which many times goes unheard. The hospital is understaffed. Technicians, doctors, nurses, sanitation workers are insufficient to handle the sheer number of patients that visit the hospital every day. As a result, the patients and the attendants are forced to stay for long. Sometimes the treatment gets delayed. We know the treatment delayed is treatment denied. The plight of the attendants in the dialysis ward is heartening. They do not have a shelter nor a place to stay. If there has been one complaint that was consistent, it is the unpalatable food. Added to that is the unhygienic state of washrooms, with water seeping from ceilings but not a drop from the taps. The patients have expressed their concerns and said that this is forcing them to make out-of-pocket expenditure towards basic needs like food and water despite free treatment. KGH has always been a poor man's friend and offers quality healthcare services, but does that mean a poor man or a middle-class taxpayer be deprived of a decent washroom, a shelter, or be given bad food? Sri V.V. Lakshminarayana Garu has visited the hospital on 31st October 2021 and inspected the condition of the wards, interacted with the patients to find out the problems. Upon a detailed conversation with Dr. Maithili, he has proposed alternative solutions to the problems and pledged his support through his Join for Development Foundation towards renovation and development of KGH. In highly populous democracies like India, you cannot leave everything to the governments. Paying taxes is not the end of our job. Exacting accountability, taking responsibility are your duties too. You need not study medicine to save lives, but you can be the medicine to the problems you see here. You need not construct the entire building, but you can lend a stone, like the proverbial squirrel. Here's a call to the ones watching the Zevi, to the ones moved by this cause, to the ones who resonate with us, to come forward and extend your support.
Thank you for that video. That was the little AV that we planted, that which describes the whole position of KGH and what we've actually tried to do as well. With that, thank you, team. I'd now like to invite Dr. JP Garu. And sir, I always say this, and I said this previously also, that whenever I think of JP Garu, the only imagery that strikes my mind instantly is a lotus in a murky pond of politics. Someone who has not been tainted by the aura of politics despite being in that space for quite some time. JP Garu, you are a doctor yourself and you've been in the government for a very long time. How do you see the state of public health centers in the country today? And what kind of policy interventions do you think we need? Over to you, sir.
Thank you, Priyanka. Andarki namaskaram. Munduga సోదరుడు జగన్ని, ప్రియాంకని, డాక్టర్ మైథిలి గారిని మనసారా అభినందిస్తున్నాం. మరి వారందరికీ ఊతం ఇస్తున్నటువంటి లిటిల్ హ్యాండ్స్ ఆర్గనైజేషన్ మెల్బోర్న్ నుంచి స్ఫూర్తినిచ్చినటువంటి లక్ష్మీనారాయణ గారికి, అలాగే ఈవేళ మన మధ్య ఉన్నటువంటి రామ్మోహన్ నాయుడు గారికి, మరి రాబోతున్నటువంటి నా మిత్రుడు సురేష్ ప్రభు, అందరిని అభినందిస్తున్నాను. ఆంధ్ర మెడికల్ కాలేజ్ కానీ, కింగ్ జార్జ్ హాస్పిటల్ ఈ రూపంలో కానీ 1923లో వచ్చినాయి. అంతకుముందు చిన్న ఆసుపత్రిగా ఉన్నది. 1835లో మీరు ఇందాక చెప్పారు, అదే సంవత్సరం మెడ్రాస్ మెడికల్ కాలేజ్ ప్రారంభమైంది. మనకు అప్పుడు కొంచెం కంటి చురుపుగా ఒక చిన్న ఆసుపత్రిని ఇచ్చారు, తర్వాత కొంచెం పెద్ద చేశారు. చివరికి 1923లో తొలి వైద్య కళాశాల బ్రిటిష్ ఇండియాలో తెలుగునాట వచ్చింది. నేను గుంటూరులో వైద్యం చదువుకున్నాను. గుంటూరు కాలేజీ 1946లో ప్రారంభమైతే 53-54 దాకా గుంటూరు విద్యార్థులు విశాఖపట్నం మీద చదువుకునేవాడు. క్లినికల్ మెడిసిన్ కి గుంటూరులో అవకాశం లేకుండే. 53 తర్వాతే గుంటూరులో అక్కడ హాస్పిటల్ అభివృద్ధి, క్లినికల్ మెడిసిన్ వచ్చింది. చాలా చరిత్రగారైనటువంటి హాస్పిటల్. ఇన్నాళ్ళకి ఇక్కడ పూర్వ విద్యార్థులు కానీ మిగతా వాడు కానీ పూనుకోవడం చాలా సంతోషకరం. గుంటూరులో ఒక ప్రయత్నం జరిగింది. గుంటూరు మెడికల్ కాలేజ్ అలుమ్ని అసోసియేషన్ జిమ్ఖానా అని చెప్పని అబౌట్ $7-8 million వాళ్ళు రేస్ చేశారు. మంచి ఇన్ఫ్రాస్ట్రక్చర్ మిగతాది బహుశా దేశంలోనే అంత పెద్ద ఎత్తున పూర్వ విద్యార్థులు ఒక హాస్పిటల్ అభివృద్ధి కృషి చేసింది లేదు. కానీ అది చాలదు, అది కూడా చాలదు. అంటే మీకు ఎంత అవసరం అవుతుందన్న దానికి మీకు ఒక అంచనా కోసం చెప్తున్నాను. కాబట్టి మిగతా విషయాలకు వెళ్ళే ముందు రామ్మోహన్ నాయుడు గారిని కోరేది, మీరంతా పెద్ద మనసు చేసుకుని ఉత్తరాంధ్ర ఎంపీలంతా కూడా పార్టీలకు అతీతంగా ఏడాదికి ఒక్కొక్కళ్ళు ₹1,00,00,000 కేటాయిస్తే, అంత డబ్బుని గనక మరి వదాంజలంతా ముందుకొచ్చి వాళ్ళు గనక సేకరించి దానికి ఏర్పాటు చేస్తే, ఈ రెండు కలిస్తే ఒక 3-4 ఏళ్లకి కనీస సదుపాయాలు వస్తాయి. మంచి ఆసుపత్రి కాదు అప్పటికప్పుడు, అది కూడా లేకుండా మనకు సాధ్యం కాదు. దానికి కారణాలు చెప్తాను, మీకు తెలుసు కానీ కారణాలు చెప్తాను. మొట్టమొదట రామ్మోహన్ చెప్పారు ఇందాక, మనకి వైద్యం కోసం తక్కువ ఖర్చు పెడుతున్నాము, పెట్టేది కూడా సరిగ్గా పెట్టట్లేదని. కానీ కొంత క్లారిటీ కోసం నేను చెప్తున్నాను. రామ్మోహన్, ₹1 ఖర్చు పెడితే ఆరోగ్య రంగంలో ప్రభుత్వం ₹4 ఫలితం వస్తుంది సగటున. నేను ఊరికే చెప్పట్లే మాట. ఉదాహరణకి కేజీహెచ్ సహా ప్రతి టీచింగ్ కాలేజ్కి, ప్రతి జిల్లా ఆసుపత్రికి, చాలా ఏరియా ఆసుపత్రులకి, చాలా మరి కమ్యూనిటీ ఆసుపత్రులకి, పిహెచ్ఎల్కి నేను స్వయంగా తిరిగి 2018లో విస్తృతంగా తిరిగి అంచనాలు వేశాను. ఉదాహరణకి మీ నియోజకవర్గం ఉంటుంది, బహుశా పార్వతీపురం మీ నియోజకవర్గం కదా, లేదా పార్వతీపురంలో ఏరియా హాస్పిటల్లో ₹1 ఖర్చుకి ₹10 విలువ వస్తుంది. అప్పుడు ఆనాటి ఉమ్మడి ఆంధ్రప్రదేశ్లో అంత మంచి ఫలితాలు, అప్పటికప్పుడు ఆంధ్రప్రదేశ్ విడిపోయినట్టుంది, అంత మంచి ఫలితాలు ఇచ్చిన హాస్పిటల్ ఇంకోట్లేదు. కానీ కనీసం ₹4 ప్రతి చోట వస్తుంది. కాబట్టి మొట్టమొదట ఆరోగ్య రంగంలో, విద్యలో మనం చాలా ఖర్చు పెడుతున్నాం, పెట్టిన ఖర్చుకు ఫలితం రావట్లేదు. కానీ ఆరోగ్యంలో పెట్టే కొద్ది ఖర్చు 4 రెట్లు ఫలితాలు ఇస్తుంది. ఎందుకు కనిపించట్లు ఆనట్లేదంటే మీరు ఇందాక చూపెట్టారు. పారిశుధ్యం లేక, మంచినీళ్ళు లేక, కనీస సదుపాయాలు లేక అఘోరిస్తూ ఉంటే వచ్చిన వాళ్ళకి సంతృప్తి కలగదు. ఎందుకంటే ఈవేళ టెర్షియరీ కేర్, తృతీయ స్థాయిలో వైద్యాన్ని అందించాలని చెప్పంటే క్యాపిటల్ కాస్ట్ మూల పెట్టుబడి ఒక బెడ్కి సగటున ₹1 కోటి 2 కోట్ల దాకా వెళ్తుంది. కొన్నేళ్ల క్రితం నేను నీతి ఆయోగ్ ఆఫీసులో కూర్చుంటే ఒక ప్రముఖమైనటువంటి జాతీయ స్థాయిలో హాస్పిటల్స్ చైర్మన్ నాతో కూర్చున్నాడు. పరిచయం చేసుకుని నాకు చెప్పాడు, సార్ ఒక బెడ్కి ₹1 కోటి అవుతుంది సగటున నిర్మాణానికి, ఒక్కొక్క సంవత్సరం ఒక్కొక్క బెడ్కి బిల్లింగ్ ₹1 కోటి అవుతుంది. కొన్నిసార్లు ఆసుపత్రుల పేర్లు చెప్పను, కొన్నిసార్లు 2 కోట్ల దాకా వెళ్తుంది మీకు క్యాపిటల్ కాస్ట్. హైదరాబాద్లోనే ఒక ప్రముఖమైన ఆసుపత్రి ₹2 కోట్ల దాటింది పర్ బెడ్ కాస్ట్. ఎందుకంటే ఆధునిక వైద్యం చాలా ఖరీదని, ఆషామాషి కాదు. ఒక మంచి హోటల్ అంతా సదుపాయాలు కావాలి. ఒక మెషిన్, ఒక ఎంఆర్ఐ కావాలంటే $1 million అవుతుంది. సిటీ స్కాన్ కావాలంటే దాదాపు $500,000 లేకపోతే $300,000 $400,000. మీకు పెట్ స్కాన్ కావాలంటే $2.5 million దాకా అవుతుంది. స్టీరియోటాటిక్ రేడియోథెరపీ కావాలని చెప్పంటే $4-5 million అవుతుంది. $1 million అంటే $7.5 కోట్ల అయిపోయింది. ఇవన్నీ మన చేతుల్లో లేవు, ఖర్చు తగ్గించే అవకాశం లేదు. అవన్నీ కాకుండా అత్యంత నిపుణులైనటువంటి వైద్యులు, వైద్య రంగాన్ని మించిన సంక్లిష్టమైన రంగం విద్యలో మరొకటి ప్రపంచంలో నైపుణ్యాన్ని పొందడం. కాబట్టి సహజంగానే మంచి వైద్యులు, మంచి నర్సులు, మంచి ఫార్మసిస్ట్, ఫిజియోథెరపిస్ట్ వగేరా కావాలని చెప్పంటే మరి సరైన పారితోషికం లేకుండా ఉంటే నిజమైనటువంటి టాలెంట్ మన దగ్గర రాదు. అంచేత ఇవన్నీ కలిపితే ప్రైవేట్ ఆసుపత్రుల్లో, టెర్షరీ కేర్ ఆసుపత్రుల్లో, మంచి ఆసుపత్రుల్లో ₹1 కోటి దాకా యాన్యువల్ బిల్లింగ్ అవుతుంది. 60-70 లక్షల రూపాయలు అసలు లోపల సాధ్యం కాదు నాటం. మరి కేజీహెచ్లు ఎంత ఖర్చు పెడుతున్నారు ఏడాదికి? మీకు ఉన్న బెడ్లు 1,100-1,100 ఉన్నాయి అధికారికంగా. అనధికారికంగా ఇంకొక 1000 దాదాపు ఉన్నాయి. ఫ్లోర్ బెడ్స్ అంటాం మనం ముద్దుగా. ఆసుపత్రి తాకిడి ఎక్కువ ఉండేసరికి మరి డాక్టర్లు వాళ్ళని పంపించలేక పాప బెదరు చాలా ప్రాంతాల నుంచి వచ్చారని చెప్పని నేల మీద పరుపులు వేసో లేకపోతే మిమ్మల్ని నన్ను డొనేషన్కి వచ్చిన మంచం వేస్తారు. సగటున 1,800-2,000 బెడ్స్. ఒకసారి నేను కనుక్కోండి కేజీహెచ్ ఉండడం, నాకు ప్రస్తుతం తెలియదు, కానీ అన్ని చోట్ల ఇదే ఉదంతం. హైదరాబాద్ లో ఏమా
1234 బెడ్స్ కరెంట్లీ
అధికారికంగా, కానీ అనధికారికంగా దాదాపు 2,000 ఉంటాయి. 1,800 నుంచి 2,000 ఉంటాయి. కాబట్టి నిజంగా ఉన్న బెడ్స్ లెక్కేస్తే సగటున మన ఆసుపత్రులకు ప్రభుత్వం పెట్టే ఖర్చు ఏడాదికి ఒక్కొక్క పడకకి ₹8 లక్షల. 1 లక్ష ఇటుగా ఉంటుంది. దానిలో మెడికల్ కాలేజ్ ఖర్చు ఉన్నది, అది ఆసుపత్రి ఖర్చు కాదు. దానిలో నర్సింగ్ కాలేజ్ ఖర్చు ఉన్నది, ఇతరమైన పరిపాలనా సంబంధమైన ఖర్చు ఉన్నాయి. అంటే అక్కడ ₹1 కోటి ఖర్చు అవుతుంటే పడక్కి, ఇక్కడ 8 లక్షలు 9 లక్షలు ఖర్చు పెడుతుంది. ఇంకా మీరు చూపెట్టినట్టు ఇంకా ఎట్లా ఉంటాయి? కాబట్టి వైద్య రంగంలో, ఆరోగ్య రంగంలో డబ్బు సద్వినియోగం కాకపోవడం ప్రధాన సమస్య కాదు. అన్ని చోట్ల సమస్య ఉంది, కానీ కీలక సమస్య అది కాదు. అసలు వనరులు కేటాయింపలేదు. మరొకటి రామ్మోహన్ గారు మాట్లాడుతూ 2% దాకా ఇస్తున్నాం అన్నారు. లేదు, 1.1% ప్రభుత్వం ఆరోగ్య రంగం మీద పెట్టే ఖర్చు దేశంలో జాతీయ స్థాయిలో ప్రభుత్వం, రాష్ట్రాలు కలిపి, రాష్ట్రాలు దాదాపు 70%, 75% పెడుతున్నాయి. 25-30% జాతీయ స్థాయి ప్రభుత్వం పెడుతుంది. మొత్తం కలిపి 1.1% ప్రపంచంలో అత్యంత అధ్వాన్నంగా ఖర్చు పెట్టే దేశం. రెండోది ఏమవుతుంది ఇక్కడ మనకి ఈ టెర్షరీ కేర్ ఆసుపత్రుల్లో, మీరు చెప్పారు 1,250 మంది 1,500 మంది అవుట్ పేషెంట్స్ అని. కొన్ని ఆసుపత్రుల్లో అయితే గాంధీ ఆసుపత్రులు రోజు 4,000 మంది, ఉస్మానియా ఒక రోజుకు 6,000 మంది, ఆల్ ఇండియా ఏఐఎంఎస్ ఢిల్లీలో 12,000 మంది రోజుకి, 40 లక్షల మంది పైచలకు ఏఐఎంఎస్ లో ఏడాదికి అవుట్ పేషెంట్, 12,000 మంది రోజుకి. ప్రపంచంలో మరే టెర్షరీ కేర్ హాస్పిటల్లో ఇంతమంది అవుట్ పేషెంట్ ఉన్నారు. ఎందుకు జరుగుతుంది రద్దీ? ప్రాథమిక వైద్యం ఎక్కడైతే అందకుండా పోయిందో, విశాఖ చుట్టుపక్కల ఉన్న వాళ్ళంతా కూడా, లేదా హైదరాబాద్ చుట్టుపక్కల ఉన్న వాళ్ళంతా కూడా, అక్కడ కేజీహెచ్కో, గుంటూరు చుట్టుపక్కల వాళ్ళంతా గుంటూరుకో, ఇక్కడ గాంధీ ఉస్మానియాకో, చిన్న చిన్న జబ్బులకు కూడా దగ్గరలో ఉన్న వాళ్ళు ఆ సీట్లో ఉన్న వాళ్ళు వచ్చేస్తున్నారు. ఎందుకంటే వేరే మార్గం లేదు. టెర్షరీ కేరు అవసరం వేరు, వనరులు వేరు, నైపుణ్యం వేరు. ప్రాథమిక ఆరోగ్యం ఎప్పుడైతే లేకుండా పోయిందో, అంత ముఖ్యంగా ఇప్పుడు మీకు మనకి సీజన్ అప్పుడు దోమలు బాగా ఉన్నప్పుడు అందరికీ భయం వేస్తుంది, మనకి డెంగ్యూ వైరస్ వస్తుందని చెప్పారు. ప్రతి జ్వరం కూడా డెంగ్యూ అనుకుని వచ్చేస్తారు హాస్పిటల్.
Sorry to interrupt you. I'm just recognizing the presence of the Honorable MP, Suresh Prabhu Garu. Suresh Prabhu ji, namaskaram and welcome to the Charity Dinner Conference.
Thank you.
Suresh ji, Jay Prakash, welcome.
I
JP
will
sir, you
I
could
will request you, rather than
deliver the
interrupting
welcome.
such a great personality like my dear friend Jayaprakash ji, let him continue, because he is one of the most distinguished person I met. I will not even call him politician. I will not even call him ex IS. He's a distinguished human being. So I don't want to interrupt him. Let him continue. I can wait for some time.
Very
Sure,
kind of you, Sureshji. I'll speak in English in your honor. I was speaking Telugu so far. So the broad point is the tertiary care is extremely expensive in almost all the medical college teaching hospitals in the country. Our expenditure is a fraction of what the private sector spends. Per bed, about 8 to 10 lakhs, as opposed to 1 crore or more in quality tertiary care private hospitals. And for every rupee we are spending, we are getting a benefit of 4 rupees in terms of value. I valued the services at the low end of the private spectrum. I simply quantified the services: outpatient, inpatient, surgery, childbirth, all kinds of surgical interventions, etc. At the low end of the private sector spectrum, and you find everywhere, for every rupee you spend, you're getting 4 rupees. Therefore, there is no substitute to allocation and, as I mentioned before, quality primary healthcare system, so that there's no excessive burden on the tertiary care hospitals. India has the unique spectacle of thousands of people thronging the tertiary care hospitals. Even Mayo's Hospital, the world's best hospital by any standard, it gets only a few hundred patients a day, because primary care, secondary care people don't go there. Only tertiary care cases go there. Now, let me focus only on tertiary care, because we are addressing ourselves to the challenges of KGH. As I said, there's no substitute to the government doing what it can, what it should. But I'm delighted that all of you are coming forward to raise some resources, at least to improve the infrastructure, make it a little more hospitable. And at low cost, there are low-hanging fruit. You can improve the conditions for the patients and their attendants. At least know the water supply, the cleaning up the whole thing, painting it, removing the leakages, etc., the sewerage system, the sanitation, and some minimal infrastructure at relatively low cost that can improve the quality of care. And it's incredibly important. But what we should look at is also the bigger picture, so that we collectively, whatever we are starting here, becomes now a starting point for a concerted effort to improve the quality of healthcare. As Ram Mohan said quite rightly, COVID at least sensitized us. There's been always a crisis. The COVID crisis is not because of COVID. It is a healthcare crisis which was concealed earlier, has been exposed now. At least now is the time to wake up. Apart from improving the primary care system with choice, and I cannot resist the temptation to address Sureshji here, India is very well placed to address these problems at a very low cost. We are now spending 1% of the GDP. Ram Mohan, you don't have to go to 2% also. I am fiscally very responsible. I know ours is a poor country. Therefore, dreaming of 3 or 5% or 10% expenditure in healthcare is beyond our capacity. Just 0.5% of GDP, and I'm saying this with the greatest sense of responsibility, just 0.4 to 0.5% of GDP additional expenditure, properly deployed in primary care, where we established a large number of primary care centers, one for each 100,000 or so population, in a small town serving about 10, 15, 20 neighboring villages within 10 kilometers or so, with competition among the practitioners and choice to the patient. This is the key. Without that, merely because you pay a salary, you can no longer get service in India. The trust is gone. And with a proper referral facility, so that unless it's an emergency, people go to higher tier hospitals only with the proper referral when needed. You don't throng all Indian Institute of Medical Sciences, 12,000 outpatients a day. It's just not medicine. This is absurd. Even God cannot improve healthcare in tertiary care institutions with 12,000 outpatients. It's humanly not possible. You're pretending. So proper graded referral facilities. Secondary care, already we have a model. Telugu states have been the pioneers of Arogyasri, thanks to Rajasekhar Reddy. Now, Narendra Modi's government of India has taken up the Ayushman Bharat. It's the same model. Ayushman Bharat is maturing every year. It must get much bigger. We probably require, now we're allocating about 6,000 to 7,000 crores a year. We require about 25,000 to 30,000 crores for it to have the real reach to take care of all secondary care problems, but not tertiary care problems. If you attempt to address tertiary care problems through private sector an insurance-based system, I guarantee you, Sureshji, people like you must raise your voice, go into it in some considerable depth. I guarantee you, India will go bankrupt without improving healthcare outcomes. Because there is no end to tertiary care. It's a bottomless pit. It's necessary, but the cost always is high, incredibly high as technologies progress every day. The benefit is very low. And without addressing the primary and secondary care challenges, which are relatively low cost, high impact ones, India cannot afford to excessively deploy money in tertiary care. We must deploy some money, but not excessively. And therefore, tertiary care should be substantially government driven. But with radical change, enhance the allocations. If we are now spending 8 to 10 lakhs, we must at least go towards 25, 30 lakhs over a period of 3 years. At least 20, 25% of the private sector norm. We can't go beyond that. But at least that much we must be willing. And do it judiciously. And encourage the best private sector doctors to come and practice in government also with flexibility, not as government employees, as consultants, as attendees, and with privileges, because teaching is a very attractive thing for doctors. When I was a student in Guntur, the finest doctors were in government colleges. The best care such as was available was in government colleges. Today, let's be truthful, 90% of the best do not touch government at the barge pole. They go to Britain, they go to United States, other countries, they acquire superb skills, and they're doing a fabulous job for the country. Make no mistake about it. Indian doctors in tertiary care, of course, there are malpractices, there are all kinds of problems. We are only looking at that. But India is now an incredibly sound country in tertiary care health services. This year, we're estimating about $14 billion foreign exchange earning through healthcare services to 1 million patients coming into this country. Our outcomes are world-class at the lowest cost possible in the world. Our pharma and vaccine industry are world champions. We have seen many advantages. So let that grow. And let the better off people through insurance get private sector health. But substantially tertiary care for the bulk of the people at public cost must be substantially in public hospitals. But getting private sector, the best experts, most credible people into government with flexibility, not as employees of government, they will not come as that. But with flexibility, they work for some time here on an agreed basis. They have the attraction of teaching, and their credibility brings quality there in healthcare. Because even if you want to do it today, there is no way you can get the same credibility as some of the reputed private hospitals providing world-class services today in the country. So this money, graded money, annually about 7-8 lakhs increase. Over 3-4 years, make it 20-25 lakh rupees at least in teaching hospitals. Bring in private sector in a judicious way. When I was a student, we used to have honorary professors in government colleges. They were outstanding professors. C. Somaswara Rao, Dr. Kastanan Sadaswara Rao, some others, they were exceptional professors. They inspired us. We actually killed some of the good practices. We made government hospitals poor, lacking in credibility. I'm not saying this casually. I understand the issues with the greatest depth and passion. My daughter just now graduated from Gandhi Middle College, so I knew the things then, I know the things now. We cannot continue this and pretend that everything is okay. It's not okay. But ultimately, tertiary care, let me repeat, it cannot solve the healthcare problems. It can provide the safety network for the people who require sophisticated treatment, but it's a bottomless pit if you make that the primary manner by which you provide healthcare. America, let me conclude with this. America is spending 18% of GDP on healthcare, about half of it from government, half private sector. In per capita terms, in absolute terms, or as a share of GDP, it is absolutely the highest in the world. America ranks 35th in the world in healthcare outcomes because they have the insurance-based, substantially tertiary hospital-based model. No matter who funds it, government or private sector, you and I through insurance and government through the budget, it simply will not meet the requirements. Many well-managed countries, Canada, UK, France, Germany, many other countries, they spend half to 1/3 of what America spends. Singapore actually spends only 3.7% of the GDP. But because they designed it beautifully, they get high quality healthcare ranking much higher than the United States. Australia, I'm sure, is one of those countries which is doing a remarkably good job. So infusion of funds along with charity and you and I getting involved a design of the system so that the burden of the tertiary care is reduced and use it for the appropriate purposes, and recognizing the opportunities and limitations of tertiary care. Private sector cannot be the primary means of providing healthcare through public exchequer in tertiary care. They are doing a remarkable job in attracting the best patients in the world and in taking care of the better off people who can pay for their own health through insurance. So we have to have an extremely deeply understood, carefully designed model based on evidence and logic and the best practices in the world. Let this be the beginning. I applaud your commitment and your passion, all of you from Melbourne and elsewhere. We need that. But I also want you to think, unless the hearts fuse with minds, if you merely put in more money, hoping that something will happen, some good will certainly happen. But we must act like businessmen, whether it's government money or your private money or some other money. How do you get the best outcomes with the least resources? Suresh Ji is an expert at that.
Thank you.
He's a great,
I'll just say a few minutes.
Thrifty man. He knows how to handle resources and get the best outcomes. We are a resource poor country in general. We have to deploy resources where the best outcome is there for the people. Healthcare is absolutely the vital area because 60 million people are becoming poor every year because of poor healthcare. And it gives the biggest bang for the buck. But even that, you must deploy it wisely, smartly, so that with the money spent, you get the best outcome again within the sector. India is well placed to do that. And now is the opportunity, thanks to COVID, because the political parties, the public are sensitized. And let's hope what you're doing becomes a part of the larger process to transform healthcare sector. And if this happens, even if nothing else happens, in 10 years' time, there'll be no poverty in India, even if everything else remains still. Even if everything else is zero, because every year, let me repeat the point I made, the last point I'm making. 60 million people are descending into poverty on account of ill health every year. Either because of lost income on account of ill health or expenditure they had to incur for the high cost care. Either way, people who are not poor at the beginning of the year are becoming poor by the end of the year. In 10 years, if nothing else happens, 60 crore people will not go into poverty if only you improve the healthcare system. And how lucky we are that we can do it at a cost of just 0.5% of GDP, additional expenditure properly deployed. I ask of you to think deeply because this really is going to determine the shape of the future. Education and healthcare, no other mantra matters. Once again, I thank you all for your patience and for your wonderful work.
Thank you, Jaiprakash Ji. I will just, Priyanka Ji.
Yes, sir. Please go ahead.
Only just few words only, because after such a absolutely fantastic discourse by my dear friend Jaiprakash Ji, I think nothing more to add. I will just say a few things. Firstly, congratulations to Jagan Murari Ji for organizing this very interesting event. And Priyanka, thank you for anchoring it in such a nice way. I welcome my friends from Melbourne who are joining in for this charity dinner. I'm sorry that you are going to enjoy the dinner. I'm going to miss it. But what is important is that you all decided to come together for a noble cause and very well articulated by Jaiprakash Ji. Many of you may know, may not know. He's also a medical doctor. So I think he has actually put real life into this discussion. So thank you very much for that. I was saying this particular event is organized. It's a very noble idea. Many of you who live in Australia or places outside India, but have some roots in Andhra Pradesh or something to do with Visakhapatnam, always must be thinking, how can I contribute? Because I live so far away. So as you were saying, Jaiprakash Ji, this is the best way to do it. And as he talked about private sector participation into medical care and how the challenges of that. But just look at it like this. This is also one way of you all as private citizens living away from India, away from Visakhapatnam, away from Andhra Pradesh. How can your private contribution help a larger public cause? This is the event actually designed with that intention. I'm very proud member of parliament from Andhra Pradesh. My term, of course, is expiring soon. And thereafter, I'm hoping to join the ranks of my dear friend Jaiprakash Ji as ex-politician. So I'm waiting for that moment. But till I'm there, whatever, and even after that, whatever I can do in my own humble way to contribute to this cause, I'll be more than happy to do it. In fact, I don't know whether my member of parliament, local area development funds are available. If they're available, I already donated 13 life-saving ambulances for each of the district of Andhra Pradesh. I also already allocated for each of the 13 districts a high-level skill development center. But if there is something residual available, I would like to give it to this hospital uh, development for the hospital as well. But in whatever way we can do, in fact, I would suggest Jagan Murariji, because Jayaprakash ji, I'm there, my other colleague from Parliament is also there, Mr. Naidu, all of us, we can come together. Lakshmi Narayan ji is also there. We all can come together again and request some companies around that area, somebody to actually help rejuvenating this hospital. We can definitely do that. But I really thank my friends who are participating in this program from far away place. In fact, this is afternoon India and you are already waiting for your dinner. So I don't want to take much time, but I would say that this is a very, very good initiative. Jagan Murariji, thank you very much for organizing this. Priyanka ji, thank you for anchoring it. And of course, Jayaprakash ji, sorry, you made such a brilliant presentation that it is anything more than that, very difficult to add to this. So let me subscribe to his ideas and let us all work together. Thank you very much.
Thank you, sir. I always call Suresh Prabhuji as the man of action and man of reforms. He is not an MP as in member of parliament, but man of performance. Thank you very much, sir. When people like you speak up, the message goes loud and clear. Thank you very much for your presence. Sir, I just like to place on record that sir has released, I think, 1 crore rupees to 13 districts of Andhra Pradesh for the skill development centers. And Suresh Prabhuji has also extended his support to the JD Foundation previously in response to our Udhanam blood bank issue. Thank you very much for that also, sir. Sir, Lakshminarayan sir, would you like to deliver the word of thanks as well?
Thank you very much, Suresh Prabhuji, for joining today's session, and also the encouraging words which you have said about this particular program. And we are starting as a small help to the KGH, and also we are thinking of having a diagnostic center in the kidney affected Udhanam area of Srikakulam also. So these are 2 projects which we want to pursue. And also the people from Melbourne, they have come forward and they want to help us in this initiative. Maybe we can extend it to further to all the public health centers, PHCs and other places also. And also I would like to place, and also I would like to tell all the people who are attending, Sri Jayaprakash, Dr. Jayaprakash Narayan ji has come with the Towards Viable Universal Healthcare. A booklet has been brought out by him, and to provide effective, accessible and affordable healthcare by the Foundation for Democratic Reforms. I think definitely if the governments follow this proposal or the methods what he has suggested, I think definitely the healthcare is going to improve in this nation, and I think he is taking this cause to various governments and also is trying to pursue them to follow this particular policy. I think the governments will definitely follow this and get a better healthcare in the country. So I thank one and all for, especially Suresh Prabhuji and Dr. Jayaprakash Narayan ji and Mr. Ram Mohan Naidu ji for joining this session and encouraging all of us. And also, we, the Join for Development Foundation, along with Little Hands Organization, has organized this program, along with the sponsors, Service Me Group, Snack India, and Metronest Homes and Dosa Hut. I also thank all the media partners who have participated in this event, the Australia Ludu, Melbourne Mama, Team Envision, Job Adda Australia, Orisol Solutions, Nana Advertising Agency, and Australia Telugodu. So these are the people who have joined this session as media partners, and I hope this is going to encourage all of us with funds for helping KGH with minimum facilities and also facilities for the patients and their assistants, and also for coming up with a good diagnostic center at Udhanam. So from Join for Development Foundation, I once again thank all of you, and finally you can conclude, Priyanka.
Thank you.
Thank you, sir. Funny, would you like to convey your thanks to the sponsors, or shall I conclude?
Yeah.
Yeah, go ahead, Funny.
So thanks for the people who joined today, like Jaiprakash Narayan Garu and JD sir, along with Suresh Prabhu Garu and Ram Mohan Naidu. So these are our major sponsors. So whenever we do the social activities, these guys are, lot of support. These guys are although they're here, they always support me to do the things in India. So without these sponsor support, I couldn't have done this. I hope we already achieved the target. So, yeah. So thanks everyone for joining. Yeah, thanks Priyanka for organizing and hosting.
Thank you, Funny. The pleasure is ours.
Thank you, Lakshminarayan and JD Lakshminarayan. Thank you, Jaiprakash.
Yeah. Thank you very much.
We're a big
Mr.
fan
Funny
of
and
you
your
both,
team.
actually.
Yeah.
We love you. We love watching you both speeches. Whenever we are free, we have free time, we just go to the YouTube and watch your videos and everything. Yeah. Sorry, my name is Anil Kumar from Dosar. Nice meeting you, sir. Namaste.
Right.
Namaste, sir.
Okay. Sir, if you don't mind, Jaiprakash sir, like Rupender is, very big fan of you. Yeah.
Hello, sir. Thanks, sir. You're my biggest inspiration.
My pleasure and honor.
Thank you. So even I was telling to everyone, like you were my inspiration before you guys joined as well.
Thank you. Thank you, Funny. Thank you, hearty thanks to all the sponsors without which this event wouldn't have been possible. Once again, thank you very much. And also, I thank Sri Suresh Prabhuji, Dr. JP, Ram Mohan Naidu ji, and our Lakshminarayan sir. An absolute pleasure and honor having you with us here. We're extremely glad at your overwhelming support. Thank you for taking in time from your busy schedules. You could have done many things in this time, but you chose to be here. Itself speaks volumes and about your commitment and passion towards the society. Sincere thanks once again to all the sponsors, LHO, without which whom this wouldn't have been possible. Thank you very much. With this, I think we come to an end of the session. Thank you very much for your cooperation and support.
Good luck, all of you.
Thank
Catch hold of Ram Mohan. Make sure that all the MPs commit from the MP lads.
Sure, sir. Sure, sir.
During your duty, you have a right to ask them.
Point well noted. I'll be the first one to initiate it.
Okay.
Thank you, sir.
Right, Ram Mohan. Right, Lakshman Garu. All the best.
Thank you. Thank you.
Right, Priyanka.
Thank you, Andy. Thank you. Thank you.
Thank you, everyone. We're done.
సమాచార హక్కు ప్రచార ఐక్యవేదిక ఆహ్వానం మేరకు ప్రజాస్వామ్య పరిరక్షణ సదస్సుకు విచ్చేసిన జేడి లక్ష్మీనారాయణ గారిపై ఒక చిన్న ఏవి. అవినీతిపై అలుపెరిగని పోరాటం చేసిన జేడి లక్ష్మీనారాయణ జేడీనే ఇంటి పేరుగా.
Are we done with the session, or is there anything that's left to be done? Jaraj?
Okay, conclude the session.
All right, we're done. Thank you very much. Thank you, LHO. Thank you very much for your support. I think the session went on really well. With this, we come to an end of the session. Thank you for joining.